Hello, and thank you for joining us today for our podcast. My name is Sarah Jackson, and I'm joined by Lenny Harner, Clinical Director of Clinical Services here at Enterhealth, premier behavioral health provider specializing in mental health and substance abuse treatment. Today, we are going to be talking a little bit about the grieving process. Lenny is going to be providing us with some of his insights on how to manage grief and the experience and expectations that come with it in a lot of ways. So, Lenny, can you kind of tell a little bit about how substance abuse can complicate or prolong the grieving process? You've talked a little bit about how substance abuse or any other kind of response similar can play obviously a negative impact on the grieving process, but can you kind of finalize that a little bit and kind of make it a little bit more tangible for us?
Sure. I think that we all know that using substances is a coping skill, right? I know that a death of a loved one or a loss is a lame excuse for relapsing, but it does happen. I think too that the pandemic had a really good fortune telling in the sense that that was a loss. People lost jobs, people lost money, people were having to isolate, people couldn't socialize. And, we had more admissions that year because of the pandemic, and it was strictly alcohol. Because people's alcohol consumption increased dramatically. And that was a representation of loss. Loss of social activity, loss of jobs, loss of hobbies, and people utilized alcohol. And what I meant to say is that we had people that had never had problems before come to treatment.
Just because they all of a sudden began using a substance to cope.
The loss. Yes.
That's very interesting. Is there a reason, perhaps, why people turn to maybe alcohol as a substance more commonly as opposed to others?
Readily available. Easy obtainable. I mean, they started delivering it to our doorsteps. Not mine, but people's, which had never been done before. I mean, you had restaurants.
Yes.
Delivering alcohol.
To you without having to go.
To you.
Yeah.
That was the first. And it created a big spike in people needing treatment, people being abusers and becoming dependent because maybe genetic factors.
That they were not aware of previously.
That's right. And if the pandemic hadn't happened, it probably would not have happened to them.
Interesting.
So that's a loss. That's grieving and coping.
All right. Well, Lenny, thank you so much for joining us today to talk about the grieving process and your upcoming webinar. Really appreciate your time and sharing your insights.
All right. Thank you for having me. Look forward to doing the webinar.
If you'd like to learn more about managing grief, you can attend Lenny's webinar on Thursday, April 18th, 2024 from 12 p.m. to 1 p.m. The link to register can be found on the events and webinars page on enterhealth.com or by emailing info@enterhealth.com. If you or someone you love is struggling with grief, reach out to the experts at Enterhealth by calling 800-388-4601 or visiting enterhealth.com today.